How effective is Genioglossus advancement for severe sleep apnea? Are you curious about how effective Genioglossus advancement is for those struggling with severe sleep apnea? Let's break down the details so you can understand what this surgical option entails. Genioglossus advancement is a surgical procedure that aims to treat obstructive sleep apnea by repositioning the genioglossus muscle, which is the largest muscle of the tongue. By moving this muscle forward, the airway is enlarged and stabilized, reducing the chances of tongue-related blockage during sleep. When it comes to effectiveness, studies show that genioglossus advancement can significantly reduce the apnea-hypopnea index. This index measures the severity of sleep apnea by counting how many times breathing is interrupted during sleep. Research indicates that when genioglossus advancement is performed alone, the surgical success rate is around 53%. Success is usually defined as achieving a postoperative apnea-hypopnea index below 20, with at least a 50% reduction from the baseline. In one study, patients saw their average apnea-hypopnea index drop from about 27.5 before surgery to 17.3 after the procedure. Along with this, there were improvements in oxygen saturation levels and reductions in daytime sleepiness. For those with severe sleep apnea, genioglossus advancement alone may not always be the best option. Its success rate is moderate when used as a standalone treatment. However, it tends to work better when combined with other surgical options that address multiple areas of airway obstruction. For example, combining genioglossus advancement with uvulopalato-pharyngoplasty or with hyoid myotomy and suspension has shown higher success rates, around 61%, and greater reductions in the apnea-hypopnea index, typically between 55 and 58%. This combination is especially beneficial for patients whose airway collapse is influenced by tongue base or hypopharyngeal obstruction. The procedure itself is performed under general anesthesia. The surgeon makes an incision inside the lower lip to access the lower jaw area. A small segment of bone is cut and moved forward, along with the genioglossus muscle attachment. This advancement helps prevent the tongue from collapsing backward during sleep, thereby keeping the airway open. Selecting the right patients is key for this procedure. Those with identifiable tongue base obstruction and suitable anatomical conditions tend to benefit the most. Genioglossus advancement can be part of a broader surgical plan for severe obstructive sleep apnea, often working alongside other procedures to tackle various levels of obstruction. In summary, genioglossus advancement is an effective surgical option that can significantly reduce the severity of obstructive sleep apnea by enlarging the airway at the tongue base. For those with severe cases, it is often combined with additional surgeries to improve overall outcomes, achieving success rates that range from 50 to 60%, depending on the specific approach and individual patient factors.